with our lovely elected officials. COVID-19 has revealed more than ever how much we rely on early care and education, and has brought up immediate needs as well as long-term impacts that we must collectively address. We need to ensure the safety and well-being of early educators, children, and our community members. We must reinvent our systems of care and education with a focus on access and equity. Today, we have a really diverse group of participants on our webinar, including preschool teachers and directors, family childcare providers, parent organizers, family advocates, city and county staff, funders, and more. I'm honored to help facilitate this discussion today with Mayor Libby Schaaf, Supervisor Wilma Chan, and Assemblymember Bonta, who will be joining us shortly. And they're all, as you know, champions of our early childhood community and have made themselves available today to share resources, hear your questions, and answer them. And we will first hear briefly from each of them, and then a few of our key community leaders before moving on to the Q&A portion. And so with that, I'd like to turn it over to Mayor Libby Schaaf.
Thank you, Priya. We miss you at the City of Oakland, but it's exciting to see all the great work that you're doing. Let me just start by expressing so much gratitude to you on the front lines of this moment of tremendous community fear, anxiety, and need. And there you are doing what you do best, taking care of our most vulnerable and our babies. So thank you. We recognize that this is a really hard moment and that you are holding incredible stress and anxiety and love and compassion for taking care of our children. So I just cannot tell you how much I appreciate you being with us today, being in community, because that is the only way that we are going to get through this pandemic, and that is together. I'm hoping that some of the resources I'm going to share will be helpful. I'm hoping that our staff is going to enter some of these websites and things like that in the chat. And don't worry, we are going to email you this presentation afterwards, all the useful links, so that you will have a resource after the fact. So don't worry if you can't keep up with note taking. All right, next slide. Big news is free testing access. And then do you have a next slide? I'm sorry, I didn't look at my slides ahead of time. Good, this is the big news. You can get tested for free. Your workers can get tested. You don't need insurance. You don't need to be documented. Oakland is a sanctuary city. All are welcome. You do not have to have symptoms to get a free test from one of our City of Oakland sites. If you work or volunteer outside the home and you have no symptoms, we want you to get tested. Not only can you get tested, we want you to get tested. And so if you are inside Oakland, you can get an appointment or learn more by calling 311 or going to our website at oaklandca.gov/testing. And just know that testing is available for a large group of people who do not have symptoms. We're waiting for like the green light from Alameda County to just say testing for all, but it's almost all right now. If you're over the age of 65, if you have any underlying medical condition, and that includes if you are a smoker, you don't have to have a symptom to get tested for COVID. And as far as symptoms go, any little symptoms, if you are just not feeling right, trust that and get tested. But as a childcare worker, you are entitled to a free test without symptoms, and I believe as often as you want. So please, most of these do require appointments. We do have one walk-up center right now, Mondays, Wednesdays, and Fridays at Roots Community Health Clinic at 99th and International. That is our one walk-up spot. But our drive-up testing site at the end of Lake Merritt is open 6 days a week, and we have not been filling all the appointment slots. So don't worry, you can get tested. All right, next slide. We know that now is a time of incredible stress. Please, for yourself, I mean, we've got to take care of the people who are taking care of the people, and that is you. Please avail yourself of parenting stress helplines. The state of California has set up a 24/7 warm line. So the idea is it's not for crisis. It's just, you know, if you feel like you need a little support, these are resources that are here for you and for the families that you serve. Sorry, next slide. You are a valued small business in our city. And so I urge you to keep checking the City of Oakland's website, which is oaklandbusinesscenter.com, to find out about what resources you qualify for as a small business. I can tell you that our COVID relief fund, which you can learn more about or make a contribution to if you feel motivated, at oaklandfund.org. We have already given out 180 emergency grants to small businesses, and I know that at least 3 of them are actual childcare businesses. In fact, this picture here, it's kind of our poster example of a small business in Oakland, is Kishna's Kitties Corner. You see them photographed right here if you are online with us. We'll send you a video testimony from them. They were one of the very first businesses that we gave one of these $5,000 emergency grants to. I also cannot say enough about kiva.org. Kiva are crowdsourced loans, but because of that, they are interest-free and fee-free. They are super easy to qualify for. You do not need a credit score. You really don't. It's very, very low barrier. You can get up to $15,000 that you don't have to start repaying on for at least 6 months, and we are here to help you through that process. But it is much easier than a bank loan. Next slide. Please know yourself as well as tell your families that Oakland has enacted the strongest eviction moratorium in the state of California. And it applies not just to tenants that are residential renters, but it applies to small businesses as well. During this pandemic, you cannot be evicted for actually any reason as long as this healthcare emergency is in place. And under Oakland's law, and this is kind of what sets us apart from other jurisdictions, you can never be evicted solely for the purpose of inability to pay rent that was directly related to COVID. I encourage you, though, to get legal counseling. We have it available for free. Centro Legal de la Raza is providing a lot of our free legal counseling. And again, they have multiple languages. If you have family members that don't speak English, they are a great place to go. And again, their phone number, their website, their email is up there. And then Oakland's rent adjustment program is also available. And we provide a landlord-tenant mediation service as well. And know that the original eviction moratorium that the Oakland City Council passed expires on May 31st, but they are bringing an extension to that. And we also are exploring whether or not we can require landlords to require them to have repayment plans, give people at least a year to catch up on the rent that is owed. But know that the eviction moratorium does not excuse you from the obligation of paying rent, but it does prevent eviction because of failure to pay rent. I also encourage you, a lot of tenants are asking their landlords for rent reductions right now. Do not hesitate to at least ask. A lot of people are recognizing that the world has changed significantly. Certainly banks are giving holidays on mortgage payments. You have to check with your bank if they are doing that with consumer debt, credit card debt. It never hurts to ask in this moment. Next slide. Also, if you have workers that you've had to lay off, or if you have parents that have lost their jobs, there are extraordinary unemployment benefits available right now, including benefits for people who are furloughed for a period of time but have a job to come back to. Gig workers, there is not a 1-week delay required anymore. You can get unemployment benefits starting from the day that you lose your income. So please avail yourself. A great organization that can help walk you through any questions you have is Legal Aid at Work. But again, extraordinary benefits right now for either your workers or your families you serve. Next slide. Many of you are, I am sure, are long aware of the racial disparities in health outcomes, and specifically how COVID-19 has further exacerbated those disparities, particularly in our African American, Latino, and Indigenous Native communities. So if this is an issue that you are passionate about, you want to know how we are responding in real time, as well as our long-term plans to make some systemic policy changes and legislative changes to address the racial disparities in health, please join actually a number of the speakers on this call: Assemblymember Bonta, Supervisor Wilma Chan, and then our fourth co-chair is Dr. Tony Iton, who is amazing, as well as the rest of our task force tonight at 6 o'clock on all my different social media channels. If you need a dial-in by phone, there's the information. Please, we want your participation. We want your involvement in addressing these horrendous racial disparities in health. Next slide. All right, that's the end of my update. I look forward to answering some of your questions later. Thanks for having me, and thank you so much for taking care of our children.
Thank you, Mayor Schaaf. Now we'll hear from Supervisor Wilma Chan.
Good afternoon, everyone. Like the mayor, I want to thank all of you for participating today, and also for being frontline workers. I totally understand how difficult it is, and it's not only difficult for you, but I want to thank your families as well for allowing you to continue to do your work and to go home and have that worry about whether you're bringing COVID into your home. So I know it's kind of a very all-encompassing thing, and we just want to thank you so much, particularly our childcare workers. First slide, please. That's not it. Okay, here it is. So first of all, as you know, the Public Health Department operates under the auspices of the county, and Dr. Erica Pond, I'm sure you've all heard her name by now, issued the shelter-in-place orders, the first one on March 17th, and it's been expanded till the end of this month. We need to be prepared for the long run because right now there's no vaccine for the virus, and while businesses and others may be able to open slowly over time, it's not because we have a vaccine or we have a treatment, it's because we're weighing the economic and job issues against the healthcare capacity. And our healthcare capacity in Alameda County, I'm happy to tell you, is actually quite good, which is why we can take a risk in opening some businesses slowly over time. Next slide, please. Okay, right away, Alameda County established an emergency childcare fund, which leverages a three-tiered system. There's existing licensed childcare supply, employer and pop-up childcare, and if necessary, public agencies, brokered care sites with public agency staff. We offer subsidized childcare for up to 1,000 children through June 30th. And this includes $2 million from the state and $750 million from the Alameda County Social Service Agency. Next slide, please. And you know, there is a lot of emergency childcare need. We know this because it's in the best of times, even before this crisis, we have a shortage of childcare in Alameda County, but under this emergency, where a lot of businesses are shut down, a lot of people are fearful of doing these services in their homes, there's huge childcare demand. Of those children currently in care that we're serving, 61% are 0 to 5, which is a very hard population to serve. 42% are children of healthcare workers. 26% are children of county essential workers, and 20% of them live in the city of Oakland. We do this countywide, of course. Slide, next slide, please. Okay, no, go back. Sorry. This bar chart shows the increase in demand over the past 8 weeks. As you can see, it's growing exponentially, and the demand for essential childcare workers has now reached 790 families, or 1,135 children. In terms of slots available in the community, the response team has identified and mapped 273 licensed childcare sites with the capacity to serve 3,250 children throughout the county. The team has developed a weekly dashboard which provides deep dive by childcare sites and families by geographic, age, employment sectors, and general needs. Next slide, please. If you're an essential worker and need childcare, you can apply online, and this is the address. So make sure you visit it, or you can also visit Bananas, Four Cs, and Hively for more information. Next slide, please. That's it, okay. In April 2020, the first Alameda First Five, of which I sit on the commission, and it's all of you are probably familiar with that, approved the use of First Five reserves towards granting $3 million for young children, their families, and childcare providers, and community organizations that support them. First Five has also provided funds to support family childcare providers with staff salaries, rent, and other operating expenses. First Five has donated $350,000 to the Alameda County Food Bank. Food is really a big issue in the county right now for families with young children. Also, through a $440,000 grant to Supply Bank. Some of the other needs for young children are 250,000 diapers, 240,000 wipes, 11,000 N95 masks for workers, plus a lot of children's books, thermometers, dental hygiene items, and hand sanitizers. So for more information on what First Five offers, you can go to their website, first5alameda.org. Also, the county's social service agency and emergency operations center, in close coordination with the food bank, 211 and cities, developed a countywide interactive map that includes food distribution sites and other essential services that are open during the shelter in place. And you can actually go to this interactive map and search by location. And you can visit acgov.org, and you can go down to food distribution and services map and take a look there if you need these resources. So thank you for having me. I look forward to your questions.
Thank you, Supervisor Chan. Now we'll hear from Assemblymember Bonta, another passionate advocate for early childhood.
Step at the beginning and unmute myself, which is not something I've always done in the past. But thank you for the opportunity to be with you. Thanks for all the participants for participating, and for all of the incredible frontline work you're doing every day to support our children and help them grow and learn and keep them safe in so many different ways, physically, emotionally. And appreciate the opportunity to talk about with you a really unprecedented time for all of us. We are in the middle of a economic, a pandemic created economic recession. I was just listening to Governor Newsom's May revised budget proposal with a lot of stark and difficult challenges that lie ahead. And we've already been in challenging times for a number of weeks and months so far. And the unfortunate reality is that there's more challenging times ahead, but we need each other now more than ever. We need all levels of government working side by side. I'm proud to be working here and in other venues with Supervisor Wilma Chan and Mayor Libby Schaaf my colleagues fighting for you, our shared constituents, and appreciate the opportunity to talk a little bit about the perspective of the state when it comes to early childhood and childcare and our children. Just a couple of highlights. The governor, back on April 10th, made a couple of key announcements regarding childcare. We released $50 million to pay for free childcare for up to 20,000 essential workers at that time, and also $50 million to reimburse childcare providers for health and safety, including PPE, gloves, masks, as well as other items like cleaning supplies. That all happened through executive order, which is how we're moving often now. It allows us to be more decisive and more responsive to the challenges that we're facing. And clearly from some of our early decisions, you can see a focus on childcare for our essential workers, our frontline workers, as well as the focus on public health and public safety. It also provided additional flexibility, including allowing after-school programs to operate during regular school hours in schools and other locations to care for school-age children of essential workers. And then it allowed childcare programs to use a new provision of SNAP, the Federal Supplemental Nutrition Assistance Program, to feed children in their care. Meanwhile, we've had CDE, our Department of Education, providing weekly webinars and support circles, guidance on issues that are of interest and of need for our providers, including special education and ESL, English as a second language, parent support. And we're going to put in the chat box some of these resources so you can access them at your convenience and see some of the CDE resources that are available. Right now we have, as you know, we're emerging in phases with reopening, and we have some phase 2 guidelines as well as some phase 3 guidelines. We're in phase 2 now, and child care facilities are following the guidance set by the Department of Public Health and also that are found on the CDE website. Schools, of course, remain closed for now in terms of on-site learning, but continuing with our virtual learning. And then phase 3, what we might see in some of our schools is potential modifications that include staggered start times or staggered a blended learning with students doing some virtual learning, doing some on-site learning, potentially going to school every other day. They're not going to have assemblies with all students in one place at one time, but some of these staggered start times, this every other day being on the school site, the virtual learning at home, all involve the possibility of additional need for childcare and child support. So what the future looks like and what that blended learning looks like very much involves you as providers. Finally, we had some questions about the master plan. Of course, the master plan is the governor's master plan. It's his proposal. It's his ideas. He's obviously very passionate about children and families and preschool and child care. He's really taken steps to own that space and design a multi-year, multi-component plan for how we strengthen our early childhood and support for our young people, and also our child care provider system. And certainly that'll have to be scaled back due to new budget realities. Any expansions and augmentations that were in the January proposal of the governor have been, for the most part, removed in the May revise. That was released today. The priorities in the budget are COVID-19 recovery and response, as well as wildfires and homelessness. So we're more restricted in our work right now in terms of the time we have to get things done, the policy areas, the subject matter that we're focusing on, and the resources, the funding, the money that we have to be able to fund key investments and programs and support. So a tough time for all of us. Again, a time where I think we need each other more than ever, and a time that I know we will be able to move through and successfully and emerge on the other side stronger if we keep supporting each other. So again, appreciate the opportunity to be here with you. Look forward to your questions and our discussion. Thank you.
Great, thank you, Assembly Member. We're going to turn it over to Clarissa Douthert, the incredible Executive Director of Parent Voices Oakland, who will share some information on some of the work that Parent Voices has been doing in the community.
Hi, good afternoon, everybody. I just want to thank you, Oakland Starting Smart and Strong and the committee for organizing this incredible forum, this town hall, and also to thank our elected officials for all of your work, our frontline workers, childcare providers, and a special shout out, the emergency childcare response team, and a special shout out to parents. It is very hard to parent right now. So I'm gonna just spend my, I forgot to time myself, spend my 2 minutes talking about some of the concerns that we've received and things that we, as a community-based organization rooted in early education and supports for parents, are seeing on the ground. Right after the stay in place order was implemented, we collected 350 valid responses to a series of survey ads on Facebook. And we did this primarily to be in contact with the community and as an organizing strategy, but we had an overwhelming response and then had a second round of information from 930 families in partnership with East Bay Community Foundation to distribute support to families through a fund that we are running with community. And so there's three really, you see in the slides here, of course, issues that have been lifted up from this moment and rapidly changing conditions on the ground as people go longer and longer without employment. We're extraordinarily excited and appreciative of all the work that's gone into protecting renters, making sure that unemployed families, have some economic support. And we know that there's still some gaps in services that families are expressing. And so the three things that we're looking at are food distribution and transportation. Families with young children are not as mobile as everybody else often. And so, especially when families have multiple children, there are some barriers that we'd love to be in dialogue about. If you'll see in the middle slide, the middle picture, the three top concerns, families were able to pick multiple options, but the three top concerns in food, access to food far outpaced. Paying rent was the top, access to food, and then of course, school closures were big concerns, all of which, we are still continuing to see as important issues. We also want to appreciate Oakland Unified School District for the meal sites, and then figure out coordination around volunteers and how to get families, again, who are experiencing multiple barriers, what they need. A second concern is on families experiencing homelessness, unsheltered families, with a particular focus on mothers with young children who are experiencing interpersonal violence. We've seen a sharp spike in that as an issue. And then third, communication. As the needs rapidly change, how are systems responding to the needs of community? And how are we remaining nimble and responsive? And when and where is leadership able to receive, county leadership, city leadership, and our state leadership able to receive feedback from families about needs and how we can best, how we can best, how we can best utilize the resources that you are making available. All right, thank you so much.
Thank you, Carissa. Appreciate you timing yourself. We're going to turn it over to Kim Johnson. We're really lucky in Alameda County and Oakland to have such a wonderful resource and referral agency led by Kim Johnson. I'll turn it over to you, Kim.
Hi, everybody. Thanks for having me here today, and happy to speak with everyone. Most of you know about us. We're an organization that's based in Oakland. We support families in their parenting journey. Many of you know us through our childcare resource and referral program and our childcare payment program that pays for childcare tuition for low-income families. We also have a robust program that supports our childcare providers. In response to the pandemic, Bananas is part of a countywide effort to uphold and support childcare providers and essential worker families. And Supervisor Chan described what that looks like to you on a county level. Bananas serves Northern Alameda County, and Oakland by far represents the largest number of families and childcare providers we support. Childcare providers and families have been really hard hit by this crisis, as Clarissa has already talked with you about. Over 85% of our providers in Alameda County have temporarily closed, either out of deep concern about their health and safety, or the families they serve are not essential workers, hence their revenues have vanished. Families have experienced job loss and have challenges meeting their obligations and accessing relief. So to support our community of childcare providers and families, Bananas, with partnerships for funding and materials from the state, Alameda County, City of Oakland, and donors, we've been able to provide support as depicted in this slide. With the support of First Five and Bananas donors, we have provided small cash grants for childcare providers and families. As was mentioned by Assemblymember Bonta, First Five, as well as Supervisor Chan, First Five Alameda, in partnership with Help a Mother Out and Supply Bank, we're providing diapers and wipes to families and childcare providers. We've been able to secure tablets for some of our informal providers to provide access to virtual learning activities. So many of our informal providers access services of family resource centers like Lotus Bloom, Lincoln, Roots, and Safe Passages. And they're offering their services and support on platforms like Facebook and Zoom. So these tablets provide access to these families. Bananas Childcare Program, as someone else had mentioned earlier, we support about 1,000 families on our childcare payment program before shelter-in-place took place. And by the way, many of those families are our essential workers. And the governor's additional funding supports for new essential workers has come on board and is right now valid through the end of June. In order for our childcare providers to operate safely and to reopen, childcare providers need personal protective equipment, cleaning supplies, which are really expensive and, as you all know, very hard to acquire. So with the support of the state, First Five Alameda County, the City of Oakland's Office of Emergency Services, we've received many of these supplies and funds, and we're distributing funds as well as masks, face coverings, hand sanitizers, gloves, cleaning products, paper products, the list goes on. And then finally, we're launching and phasing in 2 new supports for providers. The first is health support provided by supervised senior level nursing students from Samuel Merritt University to provide guidance and protocols to ensure a safe setting in our childcare settings. And the other is access to mental health professionals to support providers as they are operating under high levels of stress and anxiety. And this too is a countywide effort, and providers will be notified as these become available. We're rolling them out actually starting in the next couple of days. So while all these services and supports are good and welcome, Bananas, along with all the champions of families and childcare in Alameda County, recognize so much more is needed. As Assemblymember Bonta mentioned, there's a lot of advocacy going on to make sure we don't lose ground and all because of all the pressures on the state budget, because we have to take care of our kiddies. So with that, I will pass it on to my colleague, Christine.
Great, thanks, Kim. Christy Herrera now from OUSD Early Learning, the Executive Director of the Early Learning Department at the school district.
Hi, everyone. Thank you. I'm happy to be here. I just wanted to highlight some of the work that's happening in Oakland Unified, and I'm super proud to represent early learning, pre-K, TK, and OUSD. Oakland has been really committed to providing distance learning to our youngest learners. Our preschool and TK teachers have provided different packets, and in the pictures there you can see highlighted 3 of our amazing teachers who have been implementing YouTube videos, Zoom videos, all those wonderful things. Because of the digital divide in Oakland, we decided to send out packets home to families since they may not have had access to technology, and we mailed them directly to their homes, which was awesome. We're also working really closely with our community-based organizations, weekly planning how we can reopen in a safe way. We have the same concerns as everyone else, as enough cleaning supplies, thermometers, what the ratios will be, and really communicating as LEAs in the state of California to how do we reopen and when do we reopen, keeping our staff and our families and our children safe. And really continuing to stay connected to our staff, staying connected to our families, and providing them as much support and care as we can during this difficult time. And we really are trying to figure out how do we decide when we are with these new regulations, who do we serve and what are those priorities to make sure that everyone that needs services in childcare can get them.
Great, thank you, Christy. Now we'll be and I just want to mention that there's a wonderful resource on the First Five website, which is specific to COVID-19 resources. And then if you go to the next slide, there is also the Alameda County Public Health Department has developed childcare providers FAQs related to public health. So those are two really important resources that I think are also mentioned in the chat. Now we'll be transitioning to the Q&A portion, and we'll start with some of our pre-submitted questions. Just a heads up, we received over 100 questions. You know, there's a lot of unknowns out there and a lot of information that people want to know. So we'll try to get to whatever we can, and we will, as the mayor mentioned, send out after the webinar answers to the questions, all of the resources that we have available. So the first question I'm going to pose to the mayor and was submitted by Laura from Safe Passages. And the question is, how significant do you anticipate cuts to city funding for early childhood and youth development programs will be in the upcoming fiscal year? Do you have a ballpark percentage? If programs that have established community relationships and are providing for the community at this time are cut, what is the plan to replace essential needs that these programs provide to children and families?
So thank you for that question. Although I just got some good news from the state of California. Thank you, Rob Bonta. I don't know if it's quite ready for announcement yet, but it's made the situation a little bit better. I have not put forward my budget yet. It will become public on May 22nd. But I can tell you that I have been working very hard to ensure that there are no cuts to youth development services and to our early childhood, particularly our Head Start programs. So it's not all done yet. I'm still working hard, but that is my goal. And I believe that I have some tools at my disposal to make that the case for the next year. Now I'm willing to go out on a pretty far financial limb as far as like emptying out our rainy day fund, doing a bunch of things that are very risky, that assumes we're not going to be in this recession for an extended period of time like we were in the Great Recession that really went from like 2008 to 2010. A lot of people are projecting that this will be far worse, but at least shorter lived. But a lot of that is still unknown. But at least for this coming year, I believe I can preserve these critical services. In Oakland, we are committed to an equity focus. And we believe that taking care of our children and taking care of our most vulnerable populations has got to be our first priority, especially in this moment. And Wilma, I think you missed talking about the incredible food resources that are available right now for your families. The Oakland Unified School District just announced that they will be continuing their twice-a-week free grab and go for families through the end of this summer. You might have seen World Kitchen announced last night a huge expansion of their work in Oakland, and we have been adding some additional grab and go sites. There is a fantastic map at acgov.org. The county's website has a great interactive map that shows you all the locations around the city where your families can go and grab groceries. Wilma talked about the wipes and the diapers that are now available in many of these sites. No one should be hungry, no one. And so please bookmark that map. I'm sure you all know about 211, but these are ways that not only are we making sure that our budget doesn't impact childcare services, but we're really trying to work holistically to ensure that everyone gets through this with their basic needs met. Priya, I want to just add one little thing. Also, the city of Oakland this week opened our own childcare center for our own city workers. And so if any of you want to get, ask questions, Nicholas Williams, who's our director of Parks and Rec, has stood up that COVID compliance compliant childcare center for City of Oakland workers, and he's happy to take your calls, although Kim at Bananas is amazing. But you all, we are gonna be in this together to make sure that childcare is gonna come back in a way that is safe, that is healthy, not just for the children, but for you and your workers. So we are very committed to that on an ongoing basis. Thanks for the question.
Thank you, Mayor. The next question actually comes from a parent, DePriest, who has a question about family supports and benefits. And I think we're going to unmute her so she can ask her question live.
Hello, can everybody see me? I don't know.
We can hear you.
Hi, I'm a married mom of 5 children ranging from ages 3 months to 9 years old. We live in a 1-bedroom apartment in San Antonio, Fruitvale area. During this time, my family is experiencing challenges of being in a small space, not being able to work, and not being able to access SNAP and cash aid because of requirements and documents. And even though I am qualified for these services, I also have family members who are undocumented and they are scared to get help. To the elected officials here, what can you do to make it easier to families like me to access these services? How much proof is really needed for SNAP, cash aid, etc.? How can families like mine access affordable, spacious family housing? And can undocumented families apply for WIC, SNAP, cash, etc.?
Thank you, DePriest. That question is for Supervisor Chan, I think.
Okay, in terms of benefits, are you on Medi-Cal by any chance?
Yes.
Okay, well, you know, if you go to our social service site and you are already on Medi-Cal, you don't have to fill out all the information on the for the food for the SNAP program, because we already put that information in, so you don't have to do it again. And we also have a situation now where you don't have to come in and sign. You can sign, you don't have to sign in person. So it should be a lot easier for you to apply for those benefits. I don't know, after this, I don't know if the state is doing anything to make those applications easier. We have a pretty long application in the state of California, but from the county's point of view, it should be pretty easy for you since you're already on Medi-Cal and you don't have to come in to sign. In terms of immigrants, you should go to our social service immigrant resource page to look at. We have a lot of numbers there for attorneys. The federal programs in general are not available to undocumented. So maybe some people in your household, if you have a mixed household, can qualify for those benefits. Others are not able to qualify for those benefits. Those are not laws that we pass. Those are laws that Washington passed. So we would ask you, those attorneys are doing it pro bono. You don't have to pay. You should probably call them and explain to them what your family situation is, who the members of your household are, what their immigration status is, and find out what programs you qualify for. Because certainly some of your family members will qualify. Others, like Medi-Cal, the state of California, allows people to sign up for Medi-Cal even if they're undocumented. So it's kind of complicated, and with your different, with your family members. So please look up one of those numbers, and they're very helpful. They have, you can call multiple languages, and they can give you the information you need.
Thank you.
And if I might add, thank you for that wonderful overview as always, Supervisor Chan. A lot of, as was specified by Supervisor Chan, a lot of the answer to that question is relies on the specifics of your situation. And it sounds like you have different situations involving a family with different immigration status, perhaps, and income is going to be important. And the federal government certainly has generally excluded undocumented immigrants from support, but the state of California more and more has been inclusive. Alameda County has been a leader in supporting all community members and supporting services for all, including undocumented immigrants. So there's a lot of different services, and it can be completely confusing. And this is one of my sort of ongoing efforts to identify a one-stop, easy shop, one application where you can put in your information and your families, and you can identify all the services that you qualify for and are eligible for, whether it be from the city, the county, the state, the federal. And right now is a time where a lot of new services are coming online in real time. There's new stimulus packages coming from DC, new action and initiatives by our state, our county, our city. And so it's very difficult to keep up on everything. So that's our job to help you. So if you want to put your information, if you feel comfortable reaching out to us through the chat box or to my office generally, we can help navigate what I know could be a very confusing process to find out what you're eligible for and what services are there for you. Thank you.
Thank you.
I appreciate it.
Thank you, DePriest. Thank you. We have a question. As you can imagine, we have had a lot of questions related to reopening. And so I know Sabine has her hand up. And her question is, when can we expect to be able to reopen childcare for non-essential workers? So any insight that you could share?
I'm gonna take that one, although really Wilma should. The thing that has been really complicated during all of this is the person who makes that decision is not Gavin Newsom. It's not Wilma, it's not Rob, it's not me. It's Dr. Erica Pan. Like, you got to follow doctor's orders. That's what I keep on saying. Dr. Pan is our health officer. And if she is going to be more cautious than the governor has said she wins the day. Just ask Elon Musk. They're in a big fight, the head of Tesla. So I think we know that already the definition of who is allowed to work right now has actually expanded. You know, it's been almost 2 weeks that all construction was allowed to start again. So all of construction workers' children need childcare. And I think you're going to see, you know, we don't know for sure, but San Francisco has already announced, and typically Alameda County has been pretty aligned with San Francisco. They've announced a drive-by retail is going to start next week. So I think you're going to start seeing more people returning to work. It's not going to be all at once, but you already are authorized to provide childcare for anyone who is having to work right now outside the home. And that list is getting bigger, and you should be prepared that it will be getting bigger without much warning on a week-by-week, potentially, basis. So I'm sorry that that's a complicated answer, but it's also, I think it's really important people know, don't listen to the governor as much as going onto Alameda County's website and seeing what your county is doing. We've been more cautious than the rest of the country, and we should be proud of that, because we know that we have saved thousands and thousands of lives because we were the first region in the country to shelter in place. And so we are not going to give up on those hard-fought wins that we really have avoided so much human suffering.
Yeah, I just want to say that I think that the guidelines by Dr. Pan are that we will open as soon as we think it's safe. There are certain guidelines that the governor put out that Alameda County is also following in terms of, we want to be able to do 3,000 tests a day. We want to make sure that the increase in cases and deaths are more or less flat. Just so you know, there were still an additional, I think, 50 or 60 cases just overnight. So we're not quite there yet. The number of people in hospitals, in ICU and hospital beds is going down. So that's a good thing. I have confidence in Dr. Pan. I mean, we get to give her our opinion. I think the main thing we need in Alameda County right now is to come up to the testing standards, more testing. And then we're going to be hiring contact tracers, which means that if someone has a positive test, someone is able to call them and talk to them and find out all the people that they had contact with. so that we can make sure that those people, because as you know, this disease spreads like, you know, one person has it and then they can pass it to two people. Those people can pass it to, you know, they go home and pass it to more people. So contact tracing is going to be really important. Alameda County wants to hire at least 300 contact tracers to be ready for this. And the state has started training contact tracers, I think just this week. I think there were 2 trainings online. So I think the other thing is childcare providers should start thinking about how you could make your space more safe. Things aren't gonna, like at the county, we're going to have to space people out. They're not gonna be able to be in those cubicles. We're gonna have to put lines on the ground in terms of social distancing. We may have to put up more glass panels in front of people, because just because we open doesn't mean the virus went away. The virus is not going away right now. I mean, hopefully, I mean, I wish it would, but it's not. So we're really waiting for a vaccine, and we're really waiting for treatment options. But in the meantime, if we can open safely, then we'll do it. So I think you should start thinking about, I think childcare is just amazing, because how do you keep 3-year-olds social distancing? I just can't imagine. You have to start thinking about those things. And as you have suggestions about how you can do it, I'd be happy to hear them, or you should send them to Dr. Pond, because the sooner we think something can happen safely, the sooner we'll be able to reopen.
Yeah, I'll just add to that and echo those sentiments. There's no deadline or specific date for the opening. It's going to be based on a certain set of conditions, and those conditions are going to be based on science and data and evidence, the rates of infection, the rates of death, the amount of testing, a lot of the indicators. It's multifactorial that Supervisor Chan mentioned, but the good news is we're moving closer to reopening, and we're reopening in other sectors. And we're seeing things in those sectors that are allowing the reopening, the modifications that exist with respect to physical distancing, floor plans, personal protective equipment, different protocols that are taken to keep people safe. It is wise, as Supervisor Chan mentioned, to start thinking ahead and being prepared, so you're not wasting time getting prepared once the green light goes on, but you're able to move into action and open up for business again. It is really important. You know, opening is one thing. And of course, as was mentioned, the COVID-19 hasn't gone away. So there's a big issue of voter trust, or not voter trust, but consumer trust, people trust, parent trust in this case, and confidence. Will they want to send their kids back to child care centers, preschools, family-run care providers if they're unsure about the protocols and precautions? So just putting yourselves in the heads of the parents that you work so hard every day to support, and being parents yourselves, just what would you want to see in terms of safety precautions for your children? I think that could be a good guide, but getting ahead of it and getting prepared now is really wise advice.
Great, thank you all of you. We're going to try to squeeze in 1 or 2 more questions with our 5 minutes left. Betsy has a question, and I think it's related to kind of a broader coordination.
Hi, I'm Betsy Merznick from Hirsch & Associates Philanthropic Advisors and the Hellman Foundation. Thanks so much for this session today. As many have mentioned, the COVID-19 crisis has shown such a bright light on the deep racial inequities in Oakland and Alameda County that have long held back so many of our youngest residents, their families, and caregivers. As we begin to envision our community emerging from this crisis, how do we think about working together differently in collaboration to rebuild our early childhood infrastructure, resources, and systems to truly meet the needs of all of our children and families for the future? Thank you.
Well, in Alameda County, we're quite hopeful. We did a ballot initiative right when COVID was striking in March. And the Board of Supervisors recently took a vote to certify the election. And we're waiting for a court decision, but it would provide almost universal childcare in Alameda County, and it'll give us more resources and money to rebuild the system. I think also, the mayor can talk about this, but the task force that she helped convene regarding racial disparities, we will cover every topic, I think, including childcare. And I think the issue here is really to involve the affected communities and talk to them about strategies once the COVID is over, or once we're ready to reopen.
Yeah, I'll also add the Measure C was a big win for Alameda County and for childcare generally. I'm hopeful that the courts will uphold it. The Racial Disparities Task Force that the three of us are co-chairs and that Mayor Schaaf has convened and led on so skillfully is going to be important for ongoing guidance. I think adjusting and pivoting and reacting to our budget constraints and the realities is going to be important as well. And identifying what are the most important steps to take first to build that equitable and just and fair childcare infrastructure that we all need and deserve will be really important. And I think, a coalition of voices coming together to help design that and figure out the steps, you do A before B before C to build it out is going to be really important. Also, one really important component of all this in terms of our financial constraints is the role of the federal government. There really is an opportunity for the federal government to come in a big way and, address nearly all or most of, and certainly significant parts of our operating deficit at the state level. And that would trickle down to cities and counties as well, to give us more opportunity to serve the kids and our vulnerable communities as we should. So a lot of moving parts, but one of the things that I've been really excited about is the things that we've done differently during the COVID-19 crisis that we can carry forward. One of those has been our different levels of government and representatives who do have pre-existing relationships, who have worked closely before, but are working even more closely now. And I've seen multiple occasions, especially with Mayor Schaaf and Supervisor Chan, the power of that collaboration and working together.
Thank you, Assemblymember. So we are at time. It's 1:59. The hour just flew by. Appreciate each one of the elected officials' contributions and listening to the feedback and the questions. And I know we didn't get to so many of the questions. We will be reviewing them with you and hopefully, know that this is not the end of the conversation by any means. If I would invite each of the elected officials, if you have time, to say, some parting words for the participants. And
since I started, I'll start again. Again, just thank you so much for holding our children, for holding the anxiety and fear of our parents, and helping us all navigate in these incredibly uncertain waters. I can tell you that as mayor, I'm feeling very hopeful in a strange way. And I mean that by saying that compared to where we were 8 weeks ago, we have so much more information and tools to at least navigate forward in a safe and responsible way. I also believe, and I know that the other electeds on this call do too, that there can be some silver linings in this crisis. That we have an opportunity to not just go back to business as usual. And so we really welcome your thoughts, your advocacy, your wisdom in how, as we kind of come back to living our lives, what we can do differently, how we can better compensate the workers who are doing the work of true value, like you, how we can make sure that we are more resilient and nimble the next time something like this strikes. And again, I welcome you, and I'll be sure to send out the information, an invitation to come visit the City of Oakland's Childcare Center that has been set up according to all the guidelines. If that might be helpful just to see in real life, we are here to collaborate, to continue to give you the resources and information to help your families get through this moment, and to help you as our caretakers and our precious small businesses also get through this moment. Thank you, and I look forward to continuing this fellowship and this conversation.
thank you so much, Mayor. Supervisor, do you have last comment?
Yes, I also want to thank the rest of the panel, the participants. There was a lot of information given out today, and if you, obviously you couldn't remember it all. So look at our websites. There's a ton of information there that would help answer your questions. But if it's just too much, feel free to call my office or the city or the assemblyman. I'm sure we could point you to the parts that you really need to see. And I also really do want to encourage you to give us feedback on what are your day-to-day challenges now in terms of functioning for our essential workers, and what would you need in terms of resources or guidance in terms of reopening. That would be very, very helpful to us. Thank you.
Thank you. Assemblymember?
I just want to thank you all for the collaboration, for the partnership, for the time we spent together today. It's always helpful in our work as policymakers to hear stories from the ground, from the workers, from the front lines. And so this has been very informative and helpful. I do want you to know that we see you, we value you, we're going to fight for you. That's ongoing. That's not just today during this meeting, that's every day. And so this is a conversation that is an important one, and that's an ongoing one as well. So as issues come up, we're here for you. That's our job. And the more information and the more partnership we have from you, the better we can do that job. So thanks again for having me today.
Great, thank you. Thank you so much. Thanks to our elected officials, our speakers, and all of the participants. And we will be, as mentioned, sending out the recording of the webinar, all of the resources, as well as surveys and other ways for you all to continue to get your information across to the elected officials and make sure that you're shaping, what our community's response is to this crisis. So thank you all.